so the sternum also moves forward away from the spine, making the anterior posterior thickness of the chest about 20% greater during the maximum inspiration than during expiration. Therefore, in conclusion, all the muscles that elevated the chest cage are classified as the muscle of the inspiration, and the muscles that repress the chest cage are classified as the muscles of the expiration. For example, you should know which muscle is involved in the inspiration and which muscle is involved in expiration. In this figure, lung volume increases and decreases as the thoracic cavity expands and contracts. At any time the length or thickness of the thoracic cavity increases or decreases, simultaneous changes in the lung volume occurs. You can see the before inspiration, diaphragm is relaxed, and the external intercostal muscle as well is relaxed, and sternum situation is this here is near to vertebra, and in this shows the inspiration. In the expiration, contraction of the external intercostal muscles, and this is a diaphragm where situation is change and contraction, and this cause the contraction of the diaphragm, lowering diaphragm on contraction in increase vertical dimension of the thoracic cavity, and the contraction of the external intercostal muscle causes elevation of the ribs, which increase side to side dimension of the thoracic cavity. Okay, elevated the rib cage in this situation, and the elevated of ribs causes sternum to move upward and outward, increasing front to back dimension of the thoracic cavity. This shows the mechanic of the respiration. Normal quiet breathing is accomplished with the diaphragm. Okay, during the inspiration, contraction of the diaphragm pulls the lower surface of the lungs to downward. During expiration, the diaphragm relaxes, and the elastic recoil of the lungs, chest wall, and abdominal structure compresses the lungs. During the heavy breathing, however, the elastic forces are not powerful enough to cause the necessary rapid expiration, so that extra forces is achieved mainly by contraction of the abdominal muscles, which pushes the abdominal contents upward against the bottom of the diaphragm, thereby compressing the lungs. You can see in this figure as well, the expiration in the normal condition and quiet breathing is the passive, and just in some, for example, in the exercise of in the some disease, maybe expiration will be active. And this is you can see, for the example, in the passive expiration, diaphragm is relaxation. Okay, this causes the return to the diaphragm, ribs, and sternum to resting position, and on relaxation of the respiratory muscle, restore thoracic cavity to pre-inspiratory size. Okay, and relaxation external intercostal muscle as well, and this you can see. For the active expiration, contraction of the abdominal is very important, but for the expiration, the position of the relaxed abdominal muscle is involved in this situation. In the active expiration, contraction of abdominal muscle causes diaphragm to be pushed upward, and further reducing vertical dimension of the thoracic cavity. You can see the situation is changed, and the contraction internal of internal intercostal muscle as well. This causes contraction of the internal intercostal muscles, flattens ribs and sternum, further reducing side to side and front to back dimensions of thoracic cavity. You can see, okay? Rising and lowering of the rib cage causes the lines to expand and contract. When the rib cage is elevated, ribs project almost directly, we mentioned before, forward, so the sternum also moves from forward and away from the spine, increasing the spine and anterior posterior thickness of the chest. Muscles that rise the rib cage are muscles of inspiration. We mentioned before. Contraction of the external intercostal causes the rib to move upward and upward in a bucket handle motion. Accessory muscles include the sternocleidomastoid muscles, the anterior serrati, and the scalene. Muscles that depress the rib cage are muscles expression, including the internal intercostals and abdominal recti. Other abdominal muscle compress the abdominal contents upward toward the diaphragm. We should know pressures that cause the movement of the air and out of the lungs. The lungs are the elastic structure that claps like a balloon and expels us of its air through the trachea whenever there is no force to keep it flattened. Also, there are no attachment between the lungs and the walls of the chest cage, except where it is suspended at its hilum from the mediastinum and the middle section of the chest cavity. Instead, the lungs flattened in the thoracic cavity, surrounded by this layer of the pleural fluid that lubricates movement of the lungs within the cavity. The further continual suction of the excess fluid in the lymphatic channel maintains a slight suction between the visceral surface of the lungs, pleura, and the parietal pleura surface of the thoracic cavity. Therefore, the lungs are held to the thoracic wall as if glued there, except that they are well lubricated and can slide freely as the chest expansion and contracts. Okay. Pleural pressure and its change during the respiration. Pleural pressure is the pressure of the fluid in the thin space between the lung pleura and chest wall pleura. As noted earlier, this pressure is normally a slight suction, which means a slightly negative pressure. The normal pleural pressure at the beginning of the inspiration is about -5 centimeters of the water, which is the amount of the suction required to hold the lungs open to their resting levels. During normal inspiration, expansion of the chest cage pulls outward on the lungs with greater force and creates more negative pressure to an average of about -7.5 centimeters of the water. This relationship between pleural pressure and changing lung volume are demonstrated in the figure we showed that later, showing in the lower panel the increasing negativity of the pleural pressure from the -5 to -7.5 during the inspiration, and in the upper panel increase in the lung volume of the 0.5 liters. Then during the expiration, the events are essentially reversed. Okay. We mentioned before the pleural sacs. It is the double walled closed sac that separated its lines from the thoracic wall and other surrounding structure. We have two types: visceral pleural and the parietal pleural. Okay, and what's the pleura? The pleura, a membrane which lies between the interior surface of the chest wall and the exterior surface of the lung. The lungs are surrounded by the double-layered pleural membrane or sacs. The inner layer is called of the visceral pleura, and they attached to the surface of each lungs. Outer layer is the parietal pleura and is attached to the lining of the thorax and the mediastinum. Pleura is adheres to the inner wall of the rib cage and to the upper surface of the diaphragm. This space between this layer, sometimes called the pleural space of the cavity, is really only a potential space. Normally just the layer of the serous fluid secreted by the membranes. The serous fluid binds to two layers together. Pleural cavity and intrapleural pressure. Pleural cavity is a room between the parietal pleura and the visceral pleura and close a space and is not connected to the outside of the air, or is negative. The intrapleural pressure forming. Intrapleural pressure is equal with the minus lung retractive pressure. Why? Because the intrapleural pressure is always negative, okay, less than atmospheric pressure, and for whole lifetime. Intrapleural pressure is the medium. Medium resulting is that the chest movement changes lung volumes. Formation of the intrapleural pressure, okay? In the intrapleural space is the closed space that is not connected to the outside air. The chest consists of the rib cage and the diaphragm. We mentioned before, because of the natural elastic properties of the chest wall and lungs, the chest wall wants to expand, and the lungs opposite wants to contract, okay? This causes the formation of the intrapleural pressure and keep that on the whole of time. Pleural cavity and intrapleural pressure. What is this physiological significance? Intrapleural pressure increases lung expansion for inspiration and ventilation. Another intrapleural pressure increases backflow, venous blood, and lymphatic flow to the heart. In this case, in this figure, you can see pneumothorax. What is the pneumothorax? Okay.